Now we're going to talk to Dr. Kelvin Owusu, the Medical Director of Optima Care Diagnostics. He's always here with us every Tuesday. And today we'll be looking at the mask we've been seeing people on. When and how to wear the mask, okay? It's not for everybody, so we need to learn when we should wear the mask, how we should wear them, how we should take them off, how long we should keep them, should we discard them after each use, each day, or throughout the day. If you have any questions for him as we're discussing this, let us know with the hashtag BreakfastDaily. If you want to reach us directly, our WhatsApp line is 0550-585-832. If you're outside Ghana, the country code is +233. Good morning, Dr. Kelvin.
Good morning, Dziffa.
How are you?
I'm very well, very, very well.
Thank you for being with us.
Thank you for having me.
That these are not ordinary times, even from
all.
the way you are answering my questions.
Yeah, social distancing and everything.
Hello. COVID-19. We've been seeing so many people with masks on everywhere. What should we know about the masks?
Well, I mean, I think it's refreshing to know that people are conscious of the fact that there's something going on and, they need to protect themselves. And so that's actually quite good to know. I mean, it shows that people are paying attention to an extent to exactly what's happening around them. The fact that this COVID-19 is making the rounds and there are a lot of people who are sick, and we recorded a few deaths even in Ghana. So it is a big deal. The only unfortunate thing is that for many people are not using the mask appropriately.
Really?
The question is, do they even need to wear the mask in the first place? So it's good that we are aware that there's something going on, but we should also try not to use the little resources we have available. We should manage it so that we don't run out of resources. Because we've had other countries that have actually run out of essential material, so it's a big deal, and it will be good to know when exactly to use the mask and how to use it, because using the mask itself could actually, get you infected.
How?
Yeah, because the process of putting it on and taking it off, it could...
You will touch your face.
Exactly. It could end up, getting yourself into trouble. And so if you don't use it the right way, you could, like I'm saying, get yourself infected, actually.
Okay, so before coronavirus, what's the actual use of the mask? Because I'm looking at the box and it says surgical, disposable. What's the actual use of the masks?
Okay, so there are different types of face masks that we use in health, and even it's also used elsewhere in other industries, the painting industry, the people who work in the mines, other places. So there are several different types of face masks. The whole idea of face mask is to prevent, it's twofold. First of all, to prevent something from getting into your body. Some contaminants, either dust. In the hospital, we used to prevent infection from getting to you. That's number one. And number two, to prevent you yourself from becoming a source of infection to whoever it is that you are dealing with. So in the operating room, the surgeons, everybody in the room will actually have the face mask on, so that as you are talking, because we talk in the operating theater, as you are talking and there's saliva and other droplets coming out of your mouth and your nose, it's not going to contaminate the operating area or even into the person you are doing the procedure on. And then also, let's say you have a cough or you have a cold, and when you have the face mask on and you cough, it will not, again, contaminate the operating space. And so there is a purpose for the face mask. Now, during this COVID era, we see that everybody is wearing a face mask because, I don't know if it's because they've seen other people wearing a face mask. So I don't know if they've actually interrogated the issue to find out how or if the mask actually helps. Because according to WHO, if you are not sick, you should not wear a mask.
If you are not sick.
Exactly. So if you don't have a respiratory infection, if you don't have the COVID infection, you should not actually wear a mask.
Why?
Because it doesn't add any form of additional protection, However, if you are caring for somebody who is sick, then you must wear a mask. And the person who is sick also wears a mask to reduce the risk of the aerosols or the droplets being released when he or she coughs. And so if I'm taking care of a sick person, I would wear a mask. And so that's why it's important that if you work in a hospital, you wear a mask. And then if so in this COVID era, there's a third criteria, which I think is what is being abused, which is that if you are going into a public, like a crowded space, then you probably wear a mask so that if peradventure somebody has it and then the person starts coughing, you have some amount of protection. So those are the three. The two are the ones that WHO says we should use. So the first one is that if you are sick, you wear a mask. If you are not sick, don't wear a mask. The second one is that if you are caring for a sick person, you wear a mask. Those are the two that WHO has outlined. Then the third one, which is subjective, is that if you are going into a space or a place where you might get exposed to somebody who is infected, then you wear a mask to protect yourself. So that's the thing, because as I said, putting on the mask itself is a risk. Because it's typical human nature that when you think you have some form of protection, you tend to let your guard down.
Yeah.
So because you're wearing the mask, people are more likely to actually touch their face because they think I'm wearing a mask and protected, so they end up touching your face and then they get the infection through your eye. Because you see, it's about the mucous areas. That's the eyes, the nose, and the mouth. So now the mask has covered the mouth and the nose. That's good, but the eye is still exposed. So if you were to touch your eye, even though you're wearing a mask, you're going to get the infection. And so it's really something that we really have to pay attention to. And then also in taking off the mask again, you are going to have to touch your face to an extent. If you take off the mask and you don't dispose of it well, it could come back and haunt you in a manner of speaking. And so you have to understand that it's not entirely 100%. And also, like I said, there are different categories of masks, and they all serve different purposes. It's not all the masks necessarily that it will protect you from this coronavirus, because I've seen people using designing their own African print mask and all sorts of other things.
Is that advisable?
See, so here's the thing. I mean, I'm going to say that if you need to wear a mask, then wearing something is better than nothing at all. What I'm trying to say is that let's say you are taking care of somebody who is sick, in which case you have to actually wear the mask, and say you couldn't find any other mask, so you have to tie a scarf on your face. It's better to have the scarf on your face than to have nothing at all. However, we know that the scarf will not be effective much in protecting you against the corona, but it is better than the person who doesn't wear the scarf at all. So I'm saying that if, depending on your situation, there's a particular face mask that you probably need. And so if you don't, so for instance, if you're coming to a hospital, you realize that the hospital people are not wearing the usual mask that everybody's wearing. I mean, what we have here is the commonest one that you see around. But if you came to the hospital, okay, so let me just show you. So what we have here is the common one that most people are wearing around, which is the surgical face mask.
Okay. This
is a surgical face mask that a lot of people are wearing around. If you came to the hospital, you find a few people wearing this thing, but then there's also another type that you find people wearing, which is it's a bit rounder and it covers the face as well. The ideal face mask that we would recommend, we'd want people to wear, or in the hospital, it's called an N95 mask, or respirator as we call it, because it filters out a certain level to a certain degree. These viruses are very, very, very small. You can't see a virus with your eye. Yeah. And so it means that if the mask cannot filter to that level, then it's really...
You're just breathing everything.
Exactly, you're just breathing everything. Because there are masks for dust, there are masks for other things, and there are masks for bacteria, virus, and all those things. So each mask has its own criteria.
But is this one specifically good for protecting you against the virus?
So this one is good to an extent, but like I said, it depends on how you use it.
No,
and also how long you use it.
So let's talk about the time. There are people who have it on, then they will pull it down to talk to you.
Exactly.
Then they'll pull it back on.
So you're not supposed to do. It's very wrong. So that's what I mean by even how. So when you're wearing it, you're not supposed to touch it, because now if you touch the front of the mask, you have contaminated your hands. Now if those hands you eat with that hand without washing it, you touch your eye with that hand, you may be wearing the mask alright, but then you have infected yourself. You cannot wear the mask and pull it down and eat and put it back. You have to take it off and discard. You cannot wear the mask and what if the mask is soiled, is wet, you have to take it off and discard. You cannot reuse. This particular mask is a single-use mask.
Does that mean you can't use it tomorrow if you use it today?
No. Even if we were to take it off now, you would have to throw it away. So
wow.
So exactly, that's what I mean by you need to know what mask you are using, whether it's reusable, how long you can use it. Now, this particular mask, for instance, so in the operating theater, research has shown that it's effective for up to 2 hours.
Just 2 hours?
Yes. Now, that is in the operating theater.
Okay.
I was looking for literature, but I haven't found literature on how it's used.
Walking about with
exactly. But in theater, it can be effective up to about 2 hours of use.
And that entire time, the doctors are not touching their
No,
face.
you're not touching.
They are
You can't touch it.
focusing on the work that they are doing.
Exactly. You cannot touch it, because if you touch it, you might end up creating a hole. Because it's quite delicate. I mean, I'm sure everybody has held it before. It's a delicate material, so you cannot touch it. It's not something. It's not a toy to be played with,
Is
so
it safe to say once you touch it, throw it away? If you accidentally touch it,
it's a bit extreme if you say once you touch it, throw it away. But then you see, once you touch it, you must wash your hand.
Because you don't want to transfer it from the mask.
Exactly, because the whole idea of the mask is that everything coming from outside is stopped over here.
Okay.
So let's assume that you've had contact with somebody who has this corona. The person coughed. It has been stopped here. So luckily it didn't enter your body. But then because you wanted to talk, you decided to touch it and bring it down small so you can say whatever you need to say, and then you push it back. Or your nose was itching, so you went to rub your nose a bit. You've actually now transferred the infection from the front into your system. So that's what I mean. It's because of all these restrictions. That's why the WHO is saying that if you're not sick, don't even bother. Because if I know I'm not wearing a mask, I'm more careful. And I'm more likely to pay attention to who I'm talking to, where I'm standing, whether the distance is enough. Yes, but if I'm wearing the mask, at the back of my mind, I feel protected. So hey, anything goes. I'm likely to interact with the person and get close and all that, and then put myself at risk. And so WHO is saying that if you are not sick, if you are not coughing, if you don't have any respiratory issue, don't even bother wearing the mask at all, except if you're probably going into a crowded place. But let's say, for instance, the market, because the markets are still crowded as we are speaking.
So what are we looking at here?
So this is another kind of face mask. This I can't really see the inscription, but it looks like an N95.
Yes, the N95.
Yes, it looks like an N95. Now, see, the N95 is not about the shape. It's not the shape that makes it N95.
Okay.
It's about the material that was used to produce it.
Okay.
So you have different shapes of the N95. This is one shape of it. There are several different types of the N95 mask. So it's the material that was used to produce the N95 that filters to that degree of microscopic materials, including the viruses. But even having said that, it's not able to filter 100%. So it will filter about 98, 99%. This one will filter about 95%. And so there's still, even if you are wearing the mask, it doesn't mean that you are protected 100%. That is why you must pay attention to how it's put on and all that, and for how long you are wearing it. And once you take it off, you have to discard it. You don't take it off and then wear it again. Okay. Now, in trying to put on the mask, the first thing you have to understand, you have to do is that you have to wash your hands.
Wash your hands?
Yes, because you have to wash your hands before you wear the mask.
Okay.
Because again, remember, all this is part of protecting yourself. So now, because it's not possible to wear the mask without touching your face at all.
Yeah.
So as much as possible, reduce the risk of you transferring infection to yourself by washing your hand. So your hands are washed, and then you put. So every mask.
So you're going to show us how to.
Yes, I'm going to try to show you how to. My hands are washed already. So now every mask has a metal strip at the top. So once you identify the metal strip, it tells you which side should go up. So the metal strip, strip or the metal portion should be the top.
The top, okay.
And the purpose of the metal strip is to mold onto the bridge of your nose. So you put it on like that, and then you press it so that it takes the shape of your nose.
Okay.
So that's the top part. Now the front, the colored portion is supposed to be the front, but really
it doesn't matter.
It's really not much of a big deal. You can wear it whichever way you want to wear it. I mean, frankly, but the colored portion is supposed to be, so front, back. The important thing is the top. Okay. You have the what's it called, the metal strip at the top. Okay. Now, another thing that will give you an idea of which side should be front is how the string is inserted into the mask. So in this case, this is actually supposed to be the front.
Yeah, the white part is the front.
Exactly. But like I say, it really doesn't make a difference which side you put on. So you mold it onto your nose, and then you take the string or the elastic portion and you pass it over your ear. And then you make sure that it covers from the bridge of your nose
you're supposed to stretch it out.
Yes, you're supposed to stretch it out.
Because I've seen people with it just on without even.
No, it's meant to be stretched out. Okay. And so this is how it's supposed to be, from the bridge of your nose all the way to cover your chin to an extent, and then it spreads out like that. Now, when you're taking it off, you again make sure your hands are washed. Your hands must always be washed. That cannot be overemphasized. And then you take it off from your ear.
You just take it off from the bottom, or from the top? It doesn't matter.
It doesn't matter, but then just take it from your ear, and then
so you don't do it like from your face.
And then you get rid of it, and then you wash your hand again.
Wow.
So because the thing is, this thing after it has been used is considered contaminated.
Yeah.
So you cannot touch it without washing your hand. So if you're going to eat, you take it off, throw it away, wash your hand again.
What's so wrong with? Let's say I'm going to eat, and I'm on a budget, so I wash my hands, I pull it down here, then I eat, then I wash my hands, and then I pull it up again.
Okay, so what if you are eating?
Yes, like that.
So what if you are eating and then it crawls back up? How are you going to? You're going to pull it down with your hand, right?
I wash my hands and then pull it down, or still not.
So you pull it down with your hand. It's refusing to go there because by this time the elastic is probably stretched out and cannot really hold it in place. So it keeps coming up and going down. Then you are pushing it down and then you continue eating. Which hand are you going to use to not eat, and which hand you're going to support it with your hand? When you finish eating, before you realize a friend has come to you, and then absence of mind, you collect the banana or the orange from him or her, and then you start eating that orange. It's complicated, so just take it off and then discard it.
But what about people who keep it on the way you've kept it on, and they are just talking, doing videos?
Then why are you even wearing it?
Because when they are done, then they'll put it back on.
But then if it defeats the purpose, because remember, already, even when the thing is worn right, it's only filtering up to 95% of whatever it is that's coming in. That's when it's put on right. You've done everything perfectly well. It's only filtering up to 95%. Now, imagine that you now be touching it, pulling it down, taking it up, all those things. You are reducing the effectiveness of the item. And so you end up, at the end of the day, it's really just a cosmetic thing you're putting on. And again, for a lot of the people out there, they are using the thing for a long time.
The whole day.
The whole day, probably. And so the thing that's effective in ideal settings, it's effective for up to 2 hours. It's already being used for 4 hours, 6 hours. So again, it's not as effective as it should be. And then you are pulling it down, taking it up. And like I said, it's a delicate material. So every time you pull it up, pull it down, it's getting weaker and weaker. So really, eventually, you get the condition and you are wondering what went wrong. Probably because you're not using the right, you're not using it well. And so all we are saying is that if you are not sick, and this is WHO recommendation, if you are not sick, if you are not coughing, you don't have a runny nose or any respiratory condition right now, you don't have to wear the mask. It will obviously, at some point, so for instance, in some countries, it's mandated that everybody wears a mask. That's because their population is huge. And the population density is huge, and so moving around is almost impossible to say I'm not going to come into contact with somebody who is having a respiratory condition. So if we happen to get to that point and there is an advisory that everybody should wear a mask, that's a different matter. But for now, WHO says that if you are not sick, don't even bother wearing the thing because you are more conscious about keeping the precautions when you're not wearing the mask than when you are wearing the mask. And so you might end up getting the infection because you were overly aggressive in trying to protect yourself. So if you want to use the mask, learn the right way to use it to minimize the probability or the chance of you developing or catching that infection.
Okay, so if we decide to not use the mask, what are some things we should be doing to ensure that we don't catch the virus from the people we will interact with?
So the most important thing to do in these times, and this is something that we were supposed to be doing anyway, but thankfully Corona has made us more aware of it. Hand washing. You see, hand washing cannot be overemphasized. I mean, it's not the only thing, but it's really one of the most important things you can do for yourself. Because hand washing alone will minimize your risk of developing. Because we use our hand for so many things, we touch so many surfaces, and this is a virus that can survive on surfaces for a period of time. So you've touched, you come to work, you've typed on your computer. Somebody has come in there, coughed. You're probably not even in there, but the person came in, coughed in your absence. But you come back, you've typed on the computer, you've used your phone, you sat down, you've opened doors. Your hands are very, very dirty. You've touched the railings on what's it called, on the staircase.
Stairs, yeah.
So once you wash your hand, you remove all of that. So as often as you can wash your hand, please wash your hand. And then the next thing is the sanitizer. But sanitizer use does not replace hand washing. In fact, they are not even in competition.
How?
It's number one, it's hand. If there's water and soap provided, you cannot say I won't use it. I'll rather use sanitizer. No, they are not on the same level.
Why?
This is well researched, and we know that hand washing with soap is superior to the sanitizer use. So if you have access to water with soap, you use that one first. The use of sanitizer is for the period in between the hand washing when you cannot possibly get up and go and wash your hand, or there's no water available, then use the sanitizer. So between the sanitizer and the hand washing, you should be doing this almost all the time. Okay. You should be doing that all the time. And then the next thing is the social distancing.
Can you also use rubbing alcohol as a form
Yes, you can.
sanitizer?
You can use rubbing alcohol as well.
Okay.
Rubbing alcohol. But you see, the sanitizer is gentler on you than the rubbing alcohol. Because rubbing alcohol, it kind of burns a bit.
Yeah,
So if you have sensitive skin, some people don't like it. Sanitizer has been it's a bit calmer, so it's much more gentle on the skin. So that's why sanitizer is. But rubbing alcohol also does about the same thing. Okay. And then the next thing is the social distancing.
Yes.
You see, if you don't need to go out, don't go out. These times are these are unusual times. You cannot just go out to go and see what's happening. No, it's not that. It's
like
not.
Yesterday, people were watching the exercise. That's what not to do.
Exactly. If you don't need to go out, don't go out. Stay home. If you have to go out, then you have to observe social distancing as much as possible, if you can. It's difficult to do social distancing in the trotro and the taxis, but as much as depends on you, you should maintain a distance between. The whole idea of this social distancing.
Is it safe to say if I have extra money, pay for the seat next to me in a trotro, just so that there's a distance between myself and the next passenger? For the meantime,
it could. I mean, that's something to consider, and also if we can use what's it called? Have the windows open. That will also help a lot because in an enclosed space,
someone coughs.
Exactly. Because I'm sure the reason why there's a lot of demand for the mask is also that there's some information that this coronavirus could be airborne. Yeah. Now, let me just say that this information is not yet authenticated. It's not yet confirmed. There are conflicting research at the moment. But what we know, what we are saying is that in certain situations, yes, it can stay suspended for an extended duration of time. So, for instance, in an enclosed space where there's not much air moving, when somebody coughs, it can actually suspend in the air for a while. Let's say in a hospital, because there are so many patients and a lot of them are coughing, it can actually stay suspended for a long time. But we haven't. I mean, those conditions don't exist in the outside, so it's not conclusive that corona is airborne.
Okay.
It's just some reports coming out from the preliminary studies that are out there currently. So social distancing, very important. Hand washing, critical. And hand washing and sanitizer use, very, very, very important. We cannot overemphasize these two aspects. And of course, if you feel you are sick, if you have any of these respiratory symptoms, quickly call the corona numbers if you have them, or report to a health facility as soon as possible. And then don't go out and contaminate the rest of us, because we have to be each other's keepers. This is really a community problem, and we have to deal with it as a community and not on individual basis. Very, very important.
Thank you so much, Dr. Kelvin Owusu, for being with us. Where do we follow you on social media? Well,
I am on Facebook as Kelvin Owusu MD, and Instagram as Nase Puku.
Thank you for educating us. And again, guys, don't forget, only wear the mask if you yourself have the virus and you're trying to prevent spreading it to the people around you. Or if you're taking care of someone who's sick, and in that case, they would also need to put on the mask. So that patients will put on the mask and you will put on the mask as a way to stop spreading the virus. And if you have the virus, then you put it on. We're dealing with very scarce resources here, so let's not all go out and buy masks if we don't need to use the mask. And most importantly, don't keep touching your face, touching it, putting it on, reusing it, because then what you end up doing is you're infecting yourself with the virus, okay? Wash your hands before you take off the mask, and when you take it off, throw it away immediately. So don't say, I'm putting it away and I'm going to put it on tomorrow. Dr. Kelvin Owusu is, of course, the Medical Director of Optimacare Diagnostics, and you can follow him on his social media handles that he provided.
We hope you've enjoyed the show. Make sure you subscribe, like, comment, and share with your friends. This is Breakfast Daily on Citi TV.
Join the Breakfast Daily team Monday through Fridays from 7:30 a.m. to 10. Join us for breakfast daily, only on Citi TV.